Assalamu alaikum. It's a new video where I will discuss acute abdominal pain in women. Okay. In acute abdominal pain in women, what are the causes first? What are the reason why there is acute abdominal pain in women? First of all, it is mitral merge, that is recurrent mild, mild, recurrent mild, unilateral mid-cycle pain. So mitral merge is mid-cycle pain, mid-cycle pain, and this pain lasts hours to days. And no ultrasound is needed for mitral merge. So unilateral mid-cycle pain. Next one is ectopic pregnancy. In ectopic pregnancy, there is amenorrhea, abdominal or pelvic pain, vaginal bleeding, positive beta ECG. In here, there is no intrauterine pregnancy. Now, ovarian torsion. In ovarian torsion, there is sudden onset, severe unilateral lower abdominal pain. Sudden onset, severe unilateral lower abdominal pain. There may be nausea, vomiting, and it is unilateral tender adnexal mass on examination. On ultrasound, there is enlarged ovary with decreased or absent blood flow. This is high yield. In ovarian torsion, there is enlarged ovaries with decreased or absent pelvic blood flow. Now, rupture ovarian cyst. It is sudden onset, severe unilateral lower abdominal pain immediately following strenuous or sexual activity. Immediately following strenuous or sexual activity, if there is sudden onset, severe unilateral lower abdominal pain, and on ultrasound there is pelvic free fluid. And now PID, pelvic inflammatory disease, there is fever, chill, vaginal discharge, lower abdominal pain, and cervical motion tenderness. In PID, the complication may be tubo-ovarian abscess, may happen. Tubo-ovarian abscess may happen. Okay, adnexal masses are common and typically benign in women of the reproductive age. However, patients with new adnexal mass require assessment for emergency gynecological condition like ectopic pregnancy, torsion. So, new adnexal mass may be evaluated for ectopic pregnancy, possible malignancy, and postmenopausal ectopic pregnancy, possible malignancy like epithelial ovarian cancer. So, if there is any adnexal mass, what are the differential? We will thought ectopic pregnancy. We will thought torsion. We will thought malignancy like epithelial ovarian cancer, and there may be mass symptoms like bloating, constipation. Initial evaluation of the adnexal mass in with a pregnancy test and a pelvic ultrasound. Pregnancy test and a pelvic ultrasound visualize the ovarian blood flow and ovarian blood flow like Doppler flow, mass size, and internal mass structure. On ultrasound, malignant masses typically appear complex like solid and cystic. Malignant masses appear solid and cystic with irregular, thick, and internal septation, papillary projection. Patients with these adnexal mass require further evaluation, additional imaging, CT scan, or surgery. In contrast, adnexal masses are common in postmenopausal women and may require symptoms like pain, pressure may be found incidentally on examination. Physiologic corpus luteum reveals a simple appearing ovarian cyst with a normal Doppler flow. Because physiologic ovarian cyst resolves spontaneously. The best next step of the management is observation and repeat the examination in 6 weeks. Okay. Now again the ovarian torsion. There is enlarged ovary with decreased or absent mass. So ovarian torsion, what you will do, laparoscopic cystectomy and detorsion. If there is any absence of free fluid, differentiate ovarian torsion from a rupture cyst. If there is any absence of free fluid, that is ovarian torsion. If there is pelvic free fluid, that is rupture ovarian cyst. So cyst rupture causing the fluid to come out. So in a ruptured ovarian cyst, there is pelvic free fluid. What is the recommendation treatment for hemodynamically stable patient with a ruptured ovarian cyst? Hemodynamic stable ruptured ovarian cyst supportive, and hemodynamic unstable, you need to do urgent surgical intervention. Cyst may be follicular like unruptured, and corpus luteum cyst, these can be hemorrhagic. What's the next step for a young woman that helps with a diffuse periumbilical abdominal pain that localizes to the right lower quadrant periumbilical that localizes to the right lower quadrant? Our LMP was 25 days ago, so you need to do pregnancy test. Should be administered to any of the following childbearing age and before performing the diagnostic test. Okay, now I will discuss briefly on ovarian torsion. Ovarian torsion. In ovarian torsion, it may be risk factors are ovarian mass. Risk factors are women of the reproductive age, and infertility treatment like ovulation inducing drugs. In here, there is sudden onset unilateral pelvic pain, nausea, vomiting. There is palpable adnexal mass. Mm, so on ultrasound adnexal mass with absent Doppler flow to ovary, absent absent Doppler flow to ovary, and in treatment laparoscopy with detorsion, ovarian cystectomy, and oophorectomy. Pain is unilateral, not radiating. In here, pain is unilateral, not radiating. Laparoscopic with detorsion. Patients with partial torsion which occurs due to oscillation between the twisted and the untwisted portion, causing pain, nausea, vomiting when twisted, and relief when untwisted. Vomiting when twisted and relief when untwisted. Can cause vaginal bleeding from adnexal edema and necrosis. Physical inactivity like Complete torsion usually triggered by physical activity like walking. Remember, clinical diagnosis is it's a clinical diagnosis and a medical emergency. Doppler ultrasound can support the diagnosis, but it is not required for diagnosing ovarian torsion. So these are all about acute abdominal pain. These are all about acute abdominal pain in women and ovarian torsion. Hope you enjoy.